and we're very fortunate to have someone who is extremely experienced in the field. It's the Chief Medical Officer of Lloyds Pharmacy Online Doctor, Dr. Kieran Seyan. So I'll pass you over now. Thank you, Kieran.
Thank you very much for having me. I'm really very honoured to come and join everyone today. I can see there's like almost 60 people who are joining us. That's absolutely amazing. Really passionate and interested about this to come and join us today. So thank you very much for that, and thank you for letting me speak on the company's behalf to talk about what digital health is. It's a bit of an unenviable task, to be honest, and a little bit hard because for two reasons. One is because this field is so big, it's massive to talk about within half an hour. And also I like talking, so to talk within just half an hour or so about all of digital health is basically impossible for me. I'm not even sure I could do it in a day, but luckily you've got a whole load of other experts who probably know even more than me. I'm absolutely sure they know more than me, and you're going to learn a lot today. So I hope you really enjoy it. I am also a GP. I've been a GP for 15 years now, and about half of my career so far has been in the digital healthcare field. So as Shabini said, I'm Chief Medical Officer Online Doctor. And what does that mean? Basically, I look after all of the patient-facing stuff. So all of the clinical stuff, compliance stuff, our reception team, we call them patient advisors. And then I also help our leadership team with future strategy. What types of digital technology can we be using in the future? At the moment, we use smart algorithmic technology, and we use that to provide very safe quality consultations for patients at their convenience, and it's working very well. So there's been a good adoption by patients for that. At the moment, we have almost 4 million registered patients, so you can see that there is a want and a need for this type of technology and solution there. So I'm going to share my screen. And I believe, if I'm not mistaken, Shabina will be, if you've got any questions, you can put them in the chat, and she will store them up there and then ask me at the end. This talk should be about half an hour or so, roughly. If I go on, I'll keep an eye on the time. Hopefully I should stop on time to give you enough time for questions and stuff. So then let's make a start. So what I've tried to do with this is really to keep this at a very kind of high level. Imagine a helicopter looking down and what is all of digital health, because it's too much to cover in just such half an hour. So I'm just going to cover the most important points that I think that you need to know. So I think you should be able to see my screen now. And I'm going to move over to the next one. So what we can talk about, what is digital health? Why is it important? The different types of it and a very broad scope of it, what types of digital health, and then talk about some of the benefits and challenges that we have as well, and then any Q&A that we've got time for as well. So let's start off then. What is digital health? I think a lot of you, because you have a natural interest, you're here today with us, you have some idea about what digital health is, but there has to be a specific kind of definition that people work towards and trying to solve a problem, basically. So we always, because this is a global thing, and with globalization, we need to think about who is our main body that we would look towards that would be able to help advise us on what digital health is, and that would be the World Health Organization. I find these a little bit complicated, to be honest, in some ways, and probably not all encompassing enough. So let's just go through all of these statements that are there. Let's start with the middle one, and this is where it started off with. This is where it all started off with. So with e-health, they called digital health was then e-health. So this is the use of information and communications technology in the support of health and health-related fields. This covers basically all aspects of like what we traditionally think as digital health. So things like telehealth. It covers the operational side of things, like resource management. It covers like the compliance side of things, incident reporting, all of that kind of stuff. It covers basically a huge span of things, even supply management and things like that. But then, when the World Health Organization had this definition there, then of course we started using mobiles more. So they had to expand their definition then. So they added in a different one. So they added in mHealth. So now mHealth is basically your mobiles, and we all use our mobiles for absolutely everything. What we can see at Online Doctor is that our Online Doctor is that 85% of our patients are using their mobiles and not using desktops or tablets. So we can see that ourselves. So mHealth is basically a subset, and that's all the apps that we use. And there's, I'll come to this later, there's 350,000 apps, health apps that we can use. And so we need to think about that as an area of digital health as well. But now it's got bigger. It's a pretty hot topic at the moment because of the development of ChatGPT, and that's why it's become a hot topic. But in fact, the development of the advanced computing sciences like AI has actually been in the background for quite some time. It's just come to, I would say, the national news, not necessarily the healthcare news, but the national news because of things like ChatGPT and people adopting that type of technology. So they now define digital health as a broad umbrella term, which basically encompasses e-health, mHealth, and now the advanced computing sciences like big data, like genomics, and like artificial intelligence. So they keep on adding on stuff, essentially. So personally, it's not my favorite definition. I actually like this one. Let me get it there. There we go. So digital health is the convergence of digital technologies with health, healthcare, living, and society. And that is there to enhance the efficiency of healthcare delivery and make medicine more precise. I think this is all encompassing. It shows that there are ultimate outcomes. What are we actually trying to do? So yeah, what we actually trying to do is make the journey better for the patient, and what's for the benefit of the patient is to make the efficiency of healthcare delivery better. That means getting the healthcare to the patient as quickly as we can at the best cost that we can. And I know it's not great when we're talking within the NHS or as within the UK in general, because we're not used to paying for our healthcare service directly. However, we do have to fund the NHS and we do have to fund our healthcare in some way or another. So we do need to make it as efficient as possible, so that we can continue to provide very high quality care for our patients as well. But then the other problem, or the other solution actually, is for our patients is that we will be able to make medicine more personalized and precise. We use very general terms at the moment and very general kind of techniques, medical techniques. If I think about my normal general practice, I follow the NICE guidelines when I want to treat blood pressure. And the first thing it tells me to do is to treat all patients with this particular medication. But it doesn't tell me whether this person has a risk of side effects of this medication. It has this particular population can have reactions to this type of medication, and that's the kind of thing that AI, deep genomics and things like that can all actually help us to make more personalized and precise recommendations for our patients, basically. So that's the solution bit sorted there in this definition. And then we go to the actual beginning bit of it, the all-encompassing bit, convergence of digital technologies. We have to remember it's not just medicine. Healthcare isn't just about the doctor seeing the patient. It is about social care. It's about the day-to-day life of that patient as well. You know, the activities of daily living is what the term that we use a lot. This all counts as your health, and using digital technologies to help enhance all of those things is really important. So this, I think, is better and all-encompassing. Very personal choice. Everyone will have their own definition that they will relate to, but this for me works really well. So just to show you how big it is, this is again from the World Health Organization. It's a little bit older now. It's from 2018. You are not expected to read this. I just wanted you to show you like how big and how many different things there are around digital health. And again, as I said, this is older. This doesn't even include everything, but I think it does segment everything really, really nicely and show you the vast scale of digital health and all that it includes. So let's touch on some of those areas there. So in the top left there, you can see clients. That basically means patients. World Health Organization doesn't generally use patients, but we do in the UK particularly. So the patient side of things, these are basically patient interventions where the patient may be doing their own personal health tracking. It could be as simple as a Fitbit. That's now advancing even further and becoming even more precise. Tools like Whoop, W-H-O-O-P, is an amazing piece of technology and advancing in your health tracking. And then, of course, you've seen probably on things like, you know, Apple Watches and things like that is having an ECG. I think we've got it on the Fitbit as well. But you know, this is kind of health tracking, but there's all sorts of different types, and these are just examples that I'm just coming to the top of my head. Then there is, you know, the self-monitoring of your health as well via apps. You know, you've got your health app on your phone. It may be that the patient has been asked by their GP, is that, you know, we need to see what your blood pressure is in the morning and the evening and whether to start you on a medicine or not. And so by using very simple apps on your phone, you're going to get better adherence to, better adherence by the patient to monitor their own health, essentially. And then you've got better data capture, and actually you can store that, and then ideally that would go to the electronic health medical record. And then, you know, then there's less work for the receptionist to input all of that data that they've got as well. So this is all the patient related stuff, and it goes much further than that as well. Then let's go to the big one, the healthcare providers stuff. So this is where we at Online Doctor have the had some input into, particularly around 2.4 there. So a tiny segment is what we do, is telemedicine at the moment, and we're branching out into other things, but the vast majority of what we do is telemedicine, and you can see that very small. But that's generally, if you ask the public what they think digital health is, they will think about telemedicine, and in fact it's not. It's actually everything that's on this screen at the moment, plus AI, plus genomics, plus big data. And it's only going to expand even further. So for the healthcare provider things, this can be everything from, as I said, telemedicine, but communication tools, even using things like Teams. You know, in normal general practice, we're not very good at that, and it's often a fault that we get told that we're not communicating with each other very well, but using communication tools like that is very important. The referral coordination is very broken at the moment. That can be, you know, we can use digital health to advance the referral techniques that we use. Planning the delivery of the healthcare, resource management, all of this kind of stuff. Even actually the diagnostic side of things is very important as well. So we're capturing results from diagnostics, like I just talked to you before about blood pressure at a very basic level, but we've got newer stuff now. There's a fantastic piece of technology called Taito, which is now licensed to be used for children, and they're developing one for adults. But essentially, you put this piece of technology on the patient. Well, the patient does it themselves, but they put this piece of technology on their chest, and that is, and the technology picks up the breath sounds and heart sounds of that patient. But that's transmitted digitally to the doctor who is working remotely. Quite amazing that we're going to this, and it's supposed to be better than a stethoscope. I haven't heard it myself, but obviously it's got its regulation requirements sorted now, so it must work very well. But it just shows you the type of diagnostic solutions that are out there now for healthcare providers. The management side of things, this could be anything from HR management, and this is boring probably to most people here, but it's so essential to how a health system works and why we need digital health solutions so that everything runs properly. I saw one of the questions which one of our delegates today asked, is that why can't we adopt some of these solutions about resource management? There's several answers to that, but the point is that there are digital health solutions for exactly this type of thing. For HR management, I mentioned before, workforce planning, financing, the status of like health equipment. You know, you'll be able to know very quickly that even your thermometer is coming to the end of its life. It needs a bit of testing now, it needs a revamp, you know, that kind of thing. But more importantly, things like, you know, your resus equipment in the hospital, that is all, you can check the status remotely of it, of one computer, and do the checks, replace it, etc., all of that kind of stuff. And what we don't get very involved with as doctors, but stock level management, and it's something that I've learned over the years, incredibly important. We are sending patients here, there and everywhere to try and find a medication. We don't get when I prescribe something in general practice, we don't get any indication if something is out of stock. So a good example of that I'll give you, which I've just seen repeatedly over the 15 years, is something, an eardrop for your for otitis externa, so like an inflammation of your outer ear. And you put an eardrop in, and that solves it very quickly. but there's always manufacturing delay. So I'll prescribe this medicine, they'll go to the pharmacy, and then the patient has to come back to me, or the pharmacist will have to phone me to say that this medication is out of stock. Can you prescribe something else? I'll prescribe something else, and then that's also out of stock. So we have no overview as general practitioners or as a hospital hospital consultants and workers over what medication is in stock. And this should all be very solvable with digital health, and to have an overview of what is the most appropriate thing to prescribe for the patient, and to make that journey as smooth as possible for the patient as well. And then the final area that we'll talk about here in a bit more detail later on is around the data services. When this was written, it was more around the collection and management and use of the of data, rather than the big data stuff that we will talk about later, and what you'll probably see later on today as well. Probably one of the biggest challenges that we have is accurate coding. So when you're working in practice, if someone has a heart attack, for example, everyone in that practice needs to use exactly the same term, so that you know exactly how many patients you have in your practice that have had a heart attack over the last year, for example. So we have a problem with coding, but we should be able to solve this with some of these digital health interventions. When that's coded properly, then it can be used for things like big data, which we'll talk about later. So let's move on from there. So why does it matter? It's pretty obvious. You would have heard this before. We have got fewer doctors, we've got fewer healthcare professionals, we have more patients due to an aging population. We're basically a victim of our own success. Probably the biggest success that there has been, which is underwritten, is around public health interventions. So public health interventions, particularly in the Western world, but spreading across obviously the whole world, are the things that have decreased mortality and morbidity the most over the whole. You might think it's like medicines and stuff like that. It's not. It's actually public health interventions that have decreased our mortality and morbidity rate. So getting less disease and not dying so early, basically, those two things. But then you layer that on with chronic disease management, being able to treat, being able to treat, blood pressure, being able to treat asthma, and to treat all of these common diseases, then the patient is their mortality rate goes up again. So it goes down again, and so they live even longer. So now we have this aging population, and we have not enough doctors to be able to serve them. And it's not just doctors, it's all healthcare professionals, it's nurses, it's physios. We just don't have enough people to be able to serve all these patients. And this is where digital health can absolutely step in and help with these current challenges that we face. Do not underestimate how big this area of time is. There've only been, I did the history of medicine at school, because I've always been interested in medicine. I thought it'd be an interest, and it has helped me to just kind of reflect on and think about where we are right now as a society, and as a healthcare provision structure. So there've only been about 5 instances in time where there have been massive growths and changes within medicine. We've got the ancient Greeks, which is all around the 4 humours and Hippocrates' teachings. Then you have the medical renaissance in the 15th century, so like 1500 years later, if not more. Then in the 18th century, where you had things like vaccinations and surgery advancements. And then you've got the 20th century, where you have particularly World War I, sort of massive increase, so things like blood transfusion and further advancements in surgery. That happened in World War I. And then obviously invention of penicillin happened also in the 20th century. So those are all 4 big ones. And I would say now, this is probably the biggest thing that we are going to live through, is digital health revolution. It is absolutely massive. In 100 years, 200 years time, this time will be thought of as this revolution in medicine and adopting digital healthcare. So it's really important that we have people like you to be able to spearhead this change, because there is going to be a lot of resistance, as there is with any change. People don't like change, especially older clinicians who have been working in a particular way for a long period of time. And I'm generalizing, this is certainly not all clinicians. There's lots of people who are adopting these technologies. But there will always be resistance to traditional practice. And so we need people like you to be able to spearhead this change, because I have no doubt it will just change things in the best interest of the patient. So it's, as I mentioned, significant healthcare transformation phase. And why? It's, to be honest, it's going to be mainly AI that is going to make this these big changes. And you've got to talk later on about AI. I've got one more slide about it later on, but you will have a whole talk about it later on. But it is going to enable these major scientific breakthroughs, and we're going to be able to create new therapies. It will change our way of diagnosing people, and help to, help us to diagnose people and to think about what treatment options are available to them. But again, going back to that whole kind of stock thing, it's not just the stock, it's about making the medication, it's about putting it in the warehouses, it's getting enough space for all of those things in the warehouses. This is all part of that healthcare ecosystem, and that's what the supply chain is. So it'll be really important for the supply chain solutions as well. Okay, so I'm going to move on now to types of digital health. I liked this slide initially. I don't like it anymore, so you do have to forgive me, because it is American and there's repetition here. We don't have a difference in the UK between telemedicine and telehealth and electronic health records and electronic medical records. They're two of the same things for us. So excuse me, I probably should change this around a little bit. But this basically encompasses the e-health and the m-health bit that we were talking about with the WHO definition. So mobile apps, told you before, 350,000 apps. There's absolutely ridiculous. We have to think about what it means to be able to put an app on the App Store and what kind of regulation it has, and the actual accurate data that it's giving. So there's a slight kind of challenge in thought there, because regulation in the UK can't keep up with all of the advancements that there are. And we'll talk about that later with the challenges. I'm going to talk more about personalized medicine later on with the big data and AI. The wearable devices we covered. That's all of the the Fitbits, the Whoops, all of those kind of things. There's a ring now as well. I've forgotten the name of it, but there's a ring that can do health data management. We've got the telehealth stuff. That's the kind of stuff that we do at Online Doctor. But you've also got your accuracies and telehealth, e-consults, Babylon, all of those kind of things all count as telehealth. And there's two types of telehealth. One is called synchronous and one is called asynchronous. The synchronous one is basically when the doctor and the patient are in the same place at the same time, not in the same place, but are consulting at the same time. So you will be on a screen as the clinician, and the patient will be on their screen. So that's the synchronous consultation. But then we've got this expanding field of the asynchronous consultation, where we are giving the patient the option to give all of their information up front, maybe via something like an algorithm or via AI, and that information is transmitted to the doctor. The doctor then has all of the information in front of them and be able to make a fairly quick decision on how to treat that patient then as well. So probably a more efficient way of using our healthcare resources there. And that's an expanding field, asynchronous consultations. So you've got an idea of what e-health is now. But then let's go back to this, this definition from WHO. So we talked about e-health, talked about m-health now, but now we need to talk about the advanced computing sciences. And I think this is probably what a lot of people are really going to be interested here. So let's go on to big data. I am not going to go into a huge amount of detail here because it's incredibly complicated. To be honest, it's out of my realm of expertise. It's going into the detail, but at a high level, I'll be able to explain it a little bit. And then you've got the sessions later on to particularly talk about AI. All of these things, genomics, big data and AI, they all link in very, very closely together. I wouldn't say that they're actually three separate things. One is almost dependent on the other, essentially. You can't really have AI without the big data bit. And the same with genomics. You can't have genomics without the big data bit as well. Well, you can, but not. It's much easier with having the big data stuff. So as a healthcare industry, over the years, we have been producing a ridiculous amount of volume of data. And it's basically sitting there within general practices, within hospitals, waiting to be analysed. But it is too much for a single person to be to analyse, or to be done really by humans. we need advanced ways of being able to analyze this data. And so the way that we've collected this data is mainly through electronic health records, in general practice, like I mentioned, using wearable devices, the imaging, X-rays, CT scans. This is all data, and finally genomics. This is your genes genomics sequencing as well. What healthcare big data is basically it encompasses the collection and analysis, and then using those clinical data sets to basically make an outcome, to make a solution, or to make some recommendations, for example. So you need to be able to use all of that stuff. And the only way that that is possible, as it stands right now, is to use AI and very, very clever people like data scientists. You do need clinicians there, of course, because they need to advise the data scientists. And that's how we work at Online Doctor. We have data scientists, we have developers, and we have doctors all sitting in a row talking to each other about how to solve this problem, or how to collect this data and how to use it to be able to get the best outcome for the patient. So you need machine learning algorithms, which is one part of AI, and you need the data scientists in particular to be able to use this type of thing. So where can you use all of this big data? I won't go through every single one of these because I've just realized it's 9:30 and I'm already running out of time. But we'll go through a couple of the important ones here. Well, they're all important. So improved patient outcomes. So by analysing large data sets, healthcare providers can basically identify what is the best practice, and formulating evidence-based treatment pathways. So basically finding the best way to treat that patient. We've tried this way, we've tried this way, we've tried this way. This way that we went down here was always the best outcome for the patient. And by analysing all of that data, then basically we know we should go down this route, go down route A, not B or C. And only by using big data we'll be able to identify that. So a good example of that would be perhaps like reducing reducing medication errors. Yeah, reducing medication errors. So by analysing patient records, the software can find inconsistencies between a patient's health and prescriptions, and notify health professionals where there is any potential medication errors there. I hope that makes sense. Then we got predictive and analytics. This is pretty cool, and this is really going down the public health side of things as well. So we're talking about where healthcare professionals can predict outbreaks of epidemics in particular. So that's one big area that it can be used. Or another way could be within a hospital, is to see the flow of the patient through the hospital, going through A&E, going through AAU, going through the going to the medical ward, going to a holding ward, etc. So we can see how that patient's journey has gone through, and actually with by seeing lots of different journeys, finding out where the blockers are for that patient being discharged, using all of that data to see that this is the main blocker that we've seen. Let's try and erase that blocker now so that we can get our patients out into the community as quickly as possible. So I hope, again, makes all sense. As you can see, there is just a huge amount of where it can be applied to: disease tracking, healthcare costs, research and development is so important. And where everyone here is obviously going to be very passionate about population health management as well. And again, very much that operational efficiency side of things, really important as well. Okay, so let's move on to genomics. I find this fascinating, definitely out of my field of expertise. I struggled with genetics at university. I went to UCL and I found it very hard to understand. So for the clinicians to understand this and data scientists to do something incredible with this, I personally find it fascinating. I think it's quite amazing. And this is basically using the data that we get from individual people's genes and using that technology in healthcare. The most important part of this is the personalized medicine. You will be able to, in the future, and I think there'll be probably people here that is going to progress this, I would have thought, is to interpret genomic data and that will give you tailored medical interventions for that individual, for that patient. Basically, you know, you've got a whole load of data around people's genes, and this particular gene leads to X, Y, and Z. We already have an element of that, but it's going to grow even bigger, and you can see the chance of a patient getting a particular disease, and actually, can you do something to intervene that? Or if you can't intervene it because we don't have the solution yet, is to make their health as optimal as possible. So I think it's absolutely fascinating. That's the personalized bit. If you put that into their personal record, into their electronic health record, then you enhance the longevity of that patient even further, because it allows the clinician to make their decisions about the diagnosis and treatment. This person's gene makeup makes them more susceptible to having abdominal problems, so we shouldn't prescribe this particular abdominal medication. Then that kind of thing, I think, will happen with this. Okay, let's move on. AI. So this is, I'm only going to spend a couple of minutes on this, mainly to go through the examples, but it is very, very big. And these, you can't just call it AI, because we have different types of AI. We've got machine learning, we've got natural language processing, and we've got deep learning as well. And so basically we would use things like this to assist and ideally improve the patient experience, and that includes all the diagnosis, the treatment, and the outcomes. So a good couple of examples here, which are, you know, they're live, they've actually shown the patient experience to be better, but improve the health outcomes. So DeepMind AI, so with the NHS, DeepMind developed an algorithm to detect eye disease in their scans, and that's been shown to go to quicker diagnosis. But just last month, in the Lancet Oncology, it showed that by using AI software, we found about 20% more cancers than the usual double reading between two radiologists. So you'll still always need that radiologist there, or the majority of the time you're going to need that initial radiologist there. But can we save them some time now because of this AI software that's there, and they can go through even more cases, and then you help that backlog, which we see in breast clinic, in 2-week wait breast clinics, basically. So really, really exciting that this piece of evidence has come out, and hopefully widely accepted as well. The benefits, it's too big to talk about. There's so much stuff that we've already talked about, quite a few of them. Increased accessibility. It's quite obvious, because adoption of digital health, I shouldn't say it. Adoption of health technology is widespread across the world. Probably our biggest barrier here, which is in the challenges section, is around our older population, and we could advance too much before they're able to adopt that type of technology. However, for a younger generation, we are perhaps increasing accessibility, and I'll give you a couple of examples of this. Our own work at Online Doctor, we work with the NHS to provide sexual health test kits to boroughs in London, and where a patient would come back as positive for, say, chlamydia, the Online Doctor would be able to treat that patient remotely. That patient never has to step into a clinic, and when we have done the research into our patient population, we have been able to show that we have increased accessibility for these patients accessing healthcare. We have more people from lower socioeconomic classes accessing this service than they do in traditional face-to-face clinic. So that's kind of a local one that we have. Then you've got the worldwide. For all of the bad kind of recent press that Babylon has had, and shutting up shop here in the UK, they have done fantastic work in Rwanda. It's amazing how they've opened up accessibility of healthcare to people there with this telehealth application that they have. There would be a significant amount of patients who would not been able to access any sort of healthcare whatsoever. However, if you've ever been to Africa, my family's all from Kenya, you will see in East Africa that everyone has a smartphone. It can be a very, very basic smartphone, but they always have a smartphone. And so to access healthcare through a smartphone in all corners of a country where the transport links are really poor is absolutely amazing. So it can definitely show you the benefits of there. I can't go through all of these because there's too many of them, but you get the idea, is that we will be able to provide so many positive aspects by using and adopting digital healthcare here. Let's go on to some of the challenges though. I think probably the biggest one around that people are concerned about is around data privacy and security. And I think this is very warranted, and it's something I'm personally very interested in and very important for us to be aware of. We are holding incredibly sensitive, personal identifiable information. And so ensuring this health data is stored securely is really, really, really important. And it has to be at the forefront of every healthcare provider's, digital healthcare provider's mind. And I'm not convinced personally that it is. It very much is where I work. And of course it is within the NHS, but I'm not convinced it happens everywhere. So we do need to be very aware of that. And that links to one of the other challenges I'll talk about is regulation. As I said before, we are moving way, way too fast for the regulators to keep up. The time that they have decided how they're going to regulate a traditional telehealth service, 1,000 apps have come out and they can't keep up with that. And then that's just one part of the actual maybe delivering the service. Then you have another set of regulation around the actual medical device itself. So beforehand, the service is regulated by the CQC, for example, whereas the actual device which you're using, that's regulated by the MHRA. And we also have this fragmentation across the whole world, but even within the UK, of the different types of regulators. Within the UK, we have regulators in Scotland, Wales, England and Northern Ireland, and they all say pretty much the same thing, but not exactly the same thing. So we have to be registered with both the RQIA in Northern Ireland and the CQC and the MHRA, and now the GPHC as well. And as GMC doctors, we're also regulated by them. So there's a huge amount of regulation, and none of these guys are talking. We are compliant with everything. We would talk to everyone about it, but you can see the complexity that's around there with globalization and digital health. So I think that's a big challenge we need to work with. So I'm going to finish up now. I want you to remember, healthcare services are undergoing all of these things. We've got an increased demand, which we talked about. We've got loads of funding pressures, and there's loads of service pressures with lots of clinics being closed. As I talked about before, the reason why we work with the NHS on sexual health clinics is because a whole load of clinics had to be closed. There just wasn't the staff there to be able to support it. So they had to come up with a digital solution, which we are involved with. But it's just an example that of one area where we can help things go along. So, can digital health be part of the solution? Yes, 100%. I think so. I'm sure most of you do here, otherwise you wouldn't be sitting here today. It is not the ultimate solution by any means, but it is absolutely a big part of the solution. And can you be part of it? Well, yeah, you're already being part of it because you're here today and just discovering and learning about it. Even if you are passively listening and understanding it, you have done enough. It might not be a field that you particularly want to go into, but if you can understand it, when someone does want to adopt it in your practice, in your hospital, in your physiotherapy clinic, you can understand why they want to do it. So I think it's really important that you just understand it, and that's a really good step. One tip I will have for all of you at this beginning of your career, because I saw that as a question, how can I get into it, is to be more well informed about it. And there's not good information out there. My suggestion would be for you to join LinkedIn, which is basically a social media thing, but for work, and subscribe to things like #digitalhealth, for example. You will get so many updates and you will learn so much just from reading these posts and the potential for the future. I wish you all the best in your future in digital health. I think it'll be really excited for you, and I'm going to finish off there. Thank you.
Thank you, Kieran. That was great. I think you've accomplished a really difficult task of getting all that information in a very short period of time. So no, thank you so much. There's a wealth of information there for the students, and you've actually answered a lot. You've sort of answered all the questions, some of them that had come through. Nobody's actually put anything. Oh, actually, we've got something coming through in the chat. So let's have a look. No, just lots of thank yous. You've answered all their questions. I think there's probably one that was a recurring thing, and I think that was I mean, you answered about the obstacles and things, but I think it was just what should I read to learn more? There was a couple of people saying, where do I go to find even more information? I don't know if that was something you could give a bit of advice on.
There's too much information. There's probably one book in particular that I'll read, which I'll post in the chat. That's the only book I would say, because there's so much out there and differing kind of information there. I really do think LinkedIn, because it's such a fast moving field, to have that constant kind of update and all of the technologies and that are coming available. The other opportunity there is like for you wanting to go into that field, you're not going to see these jobs typically on Indeed. You know, you finish your training and you're not going to see it in the BMJ, for example. Not as it stands right now, it'll probably change in the future. But when you start following people in LinkedIn and start following companies and stuff like that, you'll see these opportunities come up and you will want to, you know, maybe be part of it or at least ask the question. So I'd probably go, that's my favourite, to be honest.
Okay, great, thank you. One's just come in. I'm not sure if you've quite already answered it, but I'll read it out to you. It's basically asking, in terms of digital health, what are some of the potential challenges for accessibility? I feel as though some elderly patients might miss out on the new technologies. I think you did touch on that within the talk.
Absolutely, I think it's one of the biggest things, and health inequality. So whilst I've given an example of us personally doing really well, Online Doctor, and like the Rwanda, that's the good stuff. There's definitely bad. The older population, I do worry about. That's not to say not everyone can't adopt it. The oldest patient that I've seen using digital technology is 92, and they're able to use it very, very well indeed. However, in general, they are not necessarily adept at using that technology, and there is not an easy way of being able to teach people that as well. Having said that, Age UK have got their own initiative to get people up to scratch with using technology in general, so that's really good. I'm glad to see that type of thing. It worries me slightly. I really, really enjoy elderly medicine and have done. If I didn't do general practice, I would have done care of the elderly. And I think it worries me that there's going to be reduced access for these patients. So you can see it in general practice now. We have a whole problem of patients being able to access, and we're telling people you need to use the app, you need to use Accurate, you need to use patches to book your appointment. And that really frustrates the elderly population. It frustrates my mum, and she gets really annoyed at it. And she says, "Why can't you fix this thing?" It's like, that's not me. But you know what I mean? It's like this is anecdotal, but I'm sure this is very wide across the world. So I think this is probably the biggest area that I'm personally concerned about.
Well, thank you so much. I don't think we've actually got any more time for questions. They're actually now pouring through, but I will let you go because I know you're busy. Thank you so much. Honestly, it's a great foundation as well for the rest of the morning.
Yeah,
we will try to carry on asking questions.
All right, have a lovely day, everyone. You really enjoy it. I think it's going to be great. Thanks very much.
Thank you. Okay.